A lot of people want to start a business and you think you must have the money to do the business. A business is a vision. A business is an idea. A business is you're creating something to meet a need. You don't have to have the resources to start your business. A lot of time you're starting with borrowed money or other people's money. What is your name, your clinic name, and your role in the clinic? My name is Dr. Simi Aderibibe. My clinic is Flourish Dental, Edmonton, and I am the main dentist and the business owner at Flourish Dental Clinic. How long have I been in business? I've been in business for 5 years. What services do we offer in the clinic? We offer everything general dentistry. So from restorative fillings to children dentistry, we do exams, checkup, hygiene, cleaning. We do crowns, bridges, veneers, implants, cosmetic dentistry. We offer whitening, we offer sports guard, we offer night guard for people that clench. We do root canals, endodontics, and what people don't like to do, we do extractions as well. We do offer a lot more services than this, but generally everything you can find in a general dental clinic is what we offer. What's the best way for people to connect with your business? The best way to connect with us is by going on our website, www.flourishdental.ca, or you could connect with us on Instagram, flourishdental_YEG. And then you could connect with us on Facebook, Flourish Dental, and you could also phone our office, 780-540-8155. Are you currently taking new patients, and why should people take dental health seriously? Yes, we're taking new patients. We're always welcoming new patients, so feel free to drop in at Flourish Dental. Why should people take dental health seriously? Dental health is part of your general well-being. A lot of people go for annual physicals. They check your bloods, they do all the blood work, check your general physical health. But something that is often neglected is coming to the dentist. And if you know your mouth, I tell people, is the gateway to your body. It's the portal by which 99% of the nutrients you take get into your body. So the mouth is very important. It's also connected to the eyes, the nose, the ears. And so when people neglect their dental health, it's very easy for a dental infection to connect with your eyes, with your nose, with your ears. And what that does is once it gets into the bloodstream, it becomes sepsis or it goes to the brain. So dental infections can be very deadly. So do anything you can to make sure you don't neglect your dental health. What is your advice for people who are looking to go into dentistry or start a clinic but are scared to take the leap? For people who are looking to go into dentistry, it depends on what stage you are at. If you're a student in high school, then you need to do your bachelor's, get a first degree first, and then you can apply to dental school after taking your dental aptitude test. If you're already a dentist and you're thinking of starting a clinic, but you're scared to take the leap, I'll just like to encourage you. Honestly, you just need to start and you keep learning as you go along.
Dr. Simi, welcome to Founders Outlook.
Thank you, Juliet.
During your introduction, you mentioned that dental infection can lead to sepsis. That's very scary, right? Because I don't know if it's just me. Coming from Nigeria, we don't ever go for dental checkup unless you have a toothache or dental issues. We feel, there is no need unless you have toothache. So when do you know it's time for you to start doing your dental check? Is it it from childhood? Is it? I don't understand. It's very triggering, to hear sepsis. I don't know. It's scary.
Thank you, Juliet. I didn't mean to scare you, and I don't mean to scare the audience, but these are some of the things that can happen. And I'm a Nigerian as well. Mm-hmm. And to be honest, I also didn't know much about dentistry before I went into dentistry as a course in university.
Yeah.
In fact, I don't think I ever went to the dentist before I got admitted.
So not just me.
So it's not just you.
Okay.
It's a cultural thing for us. So one of the things that we promote in this side of the world is from when a child has their first tooth.
Yeah.
So 6 months old, we say most children will have their first tooth. That's when a child should start seeing the dentist. So typically from 6 months, if the child has the first tooth before 6 months, they're free to come to the dental clinic. And usually at that age, we don't do much. It's more of an education and acclimatization for the child to get used to the dental environment. Because really, when you come into a dental operatory, there's so much going on. Our chairs are so big. Everything can look overwhelming if you're not used to that environment. But when a child starts coming from 6 months, they don't know much at 6 months, but we educate the parents. We find out about the eating habits. We find out if they started brushing that one tooth that is in the mouth. Because some people will tell you they're still using cotton wool or something. But cotton wool might not clean the plaque, the dirt on the tooth effectively. So they should use toothbrush, right? But very minimal toothpaste because the child can't spit out. So those are some of the things that we will explain to the parents. We'll talk about feeding habit, breastfeeding, things like that, bottle feeding. You know, people do bottle feeding. They put juices in bottle. They leave the child with it. These things cause issues later on. So it's more an education. You look in the child's mouth to start your dental checkups.
Thank you very much. And from your story, you mentioned you did your first degree in Nigeria. Can you walk us through, what it took you and the process it took you to launch your clinic in Canada? I mean, I know it must be draining. So can you tell us what it took you to launch your clinic?
I did my original dental training in Nigeria. But when I came to Canada, I thought it was important to actually learn the Canadian way as well. Okay. Dentistry doesn't change, but the materials, the equipment is different. And our training in Nigeria was limited. In fact, I remember for my sets, the dental students graduated 6 months after our medical counterparts because they said we didn't have enough experience because we didn't have equipment. Our equipment were faulty. So when I came to the side of the world, it was paramount that I go back to school.
Okay.
Right. And I applied to go back to the U of A. I applied to all the dental schools in Canada because it is very competitive to get into dental school here. Luckily, I got into the U of A. So as a foreign trained dentist, when you apply to go back to school, you do 2 years.
Okay.
So I did a 2-year program. I started from the second year, end of second year. And then when I graduated, I thought, okay, I am equipped. Okay. I am equipped to do what I want to do. Mm-hmm. And so it was when I finished my training at the U of A, that was the time I decided that I was just going to open my practice because by the time I was coming here, I was out of practice 20 years in Nigeria.
Okay.
Right. So it was
so you've
time.
Always known you own your practice when you came. Okay.
I've always known. You talked about challenge or what I went through.
What you went through,
I think the biggest challenge I faced was funding. To own a dental clinic. The way patients complain about how our services are expensive. We also complain everything in dentistry is expensive. In fact, there's some things I don't want to say, but then I have to say because it is what it is. My husband has a medical clinic.
Yeah.
And when we look at what we buy from the same company, same supplies, the dental ones are more expensive. There's no explanation for it. In fact, when we found out, he started buying some things for me. Okay. And then when they realized he was buying for the dental, they actually told us that no, I need to buy from the dental side. He needs to buy from the medical
side.
But because of accountability, right? That's how they found out. Because for my own bookkeeping, I need to be able to account for what I spend. So I think one day they just came to check something and everything. Then the rep said, "Oh, is the supply not for the medical office?" We're like, "No, they're just buying it for the dental." She's like, "No." So, things are really expensive for us. I feel it's really commercialized. Honestly, that's it. And so to set up a dental clinic, I spent almost like 3 to 4 times what my husband used to set up his space, right, and everything. So when we were going to start, we needed that funding for me to start. And remember, I said I had just finished my training when I decided I was starting. So when we went to the banks, it was more like, "Who are you? We don't know you."
We don't know you.
It was a challenge. In fact, it was very disappointing because when I was in school, you get funding to go to school automatically. Once you get admission into medical or dental school, here, they just put money in your account and that money will fund your time in school. So the bank that funded my education, that knew me that I went to dental school here, they were the bank I went to meet. I'm about to start a clinic.
They refused.
They refused. They were the bank that had our mortgage as a family.
I see.
They refused.
Because
my husband said, because my husband didn't have to go to school, so he had been working all along. So my husband said, "I will be a guarantor for her." They refused. It was another bank. And this other bank that helped us, honestly, I want to say there was a godsend in that bank. It was an Asian lady. She said, "You know what? These are the challenges that the Black and minority ethnic groups face." She said, "I can relate." She said, "I want to believe you're a hardworking woman. I'm going to release loan." That was another bank. We didn't have anything with that bank. We didn't have any borrowing, nothing.
No history.
And after that lady released that funding for me to start the clinic, I think like 3 months after, she left the bank.
Oh,
that's why I said
God sent her for you,
just for that purpose. So that was my biggest hurdle.
You must be a Nigerian person. God sent her. Okay, so what sets your clinic, your dental clinic? There are so many dental clinics around. So what sets yours apart, and what's your unique approach when it comes to patient care?
I think what sets us apart is we treat everybody with utmost respect, and we're very personable. So one of the things I hear from people when I meet my clients for the first time and I take time to get to know them, they'll be like, "Oh, most places where I've been to, they know the hygienist. They know the dentist is only there for 2 minutes."
Oh, okay.
A lot of people say that the dentist just comes in and goes out, right?
True.
They don't get to know you.
I experienced it.
But, I made a decision that, and so for a lot of people that come in, I tell people, I might not remember the face, but if I've had a conversation with you, I'll know something about you. So for me, it's that personal relationship with everybody. I try to have it as a dentist, right? We have a new dentist that started working with us, and that's something I've told her that it's like our culture, and I want her to carry that along. Just be personable with everyone. It doesn't matter who the person is.
Patient
I think
care,
our approach to patient care is almost similar to our culture, and it's basically we treat everyone like family. So when you come to me, it's not about the treatment or the money we're getting from it. It's about, if this was my brother, is this the treatment plan I would have given? If this was my daughter, is this a treatment plan? And so I treat everybody like family. And so sometimes it might be like, "Oh, you're not making money," because you could have offered something else, that'll be money. But it's not about that. It's that reputation that I'm treating everyone like family. It just makes me feel good with myself. So.
And I would like to throw this out here. Most people, if you're working, you may probably have coverage for dental care. I think most people, they are not aware, maybe because they don't have dental issue. So it's not like you're paying out of pocket. So
Absolutely.
you should go check out your teeth.
Thank you.
So how has your business evolved from the first day you started, and where do you see it in the next few years?
There's been a lot of growth since we started. Recently, we expanded, so we have a new operatory. We used to have 3 rooms before. But recently, we have our 4th room up and running, so that's been a massive thing, right? Then the services we're offering a lot more services than when we first started. When I started, we were not doing a lot of orthodontics. So over the years, we started with Invisalign, clear aligners, and now we're actually offering braces, so bracket braces. If somebody wants, we're able to offer that. Within our remit. So that's some of the things that we've evolved over time. And very soon, we hope to be offering implants.
Oh, nice.
Looking forward to sometime next year.
Start
offering implants in-house.
So you're just growing.
Yeah.
So, it's hard for some people to kind of separate being a business owner and also working in the business, right? How do you manage being a skilled dentist and also a business owner?
I think discipline is one of the biggest things with that. Being a business owner and being a clinician, a skilled clinician. So when I talk about discipline, when I'm there as a clinician, I tell the staff that's not the time you bring administrative tasks and things. Because honestly, once I start my day at 10 o'clock, I look at my patients, I look at the last time I saw them, what do I have to do today, It's just like you're brainstorming until. And a lot of times in dentistry, you never know what you're going to face when you go in. It might look like an easy procedure. You get in there, it goes sideways, right? And everything. So I try to distinguish my time. I have days when I'm off. Those days are strictly business days. So I'm strategizing for the business and things like that. One of the things I've also done is empowering my team, right? I can't do it all alone. And I'm grateful for the team I have. So empowering them to be able to take on responsibility, I delegate to them and everything. And also just developing systems such that when I'm not there, the business is running, I was away this summer for, I think, maybe 3 weeks. I had different engagements. And to see that the clinic was functioning even when I was not there was awesome. I just want to also encourage people, because a lot of people have been used to always seeing me when they come to the clinic. So we're having challenges. People come now and insist, we just want to see Dr. Simi. I'm like, we have another dentist she's very experienced, 20 years, very capable of doing what she has to do. But people still say, no, it's Dr. Simi we came to see. But I try to, like I said, guard the clinician time, the business owner time, empower my team. I also try to just stay focused. And when I say focus, it's especially the area where I'm in. There are a lot of dental clinics. And easily you can get into the comparison game and say, especially when you look at Google reviews, you see clinics, 800. You see your own, you say, where are we? Right? And everything. But no, I just focus on my own journey, on what my goals are, and I take it a day at a time. I tell myself, if I improve 1% a day, that's okay. An improvement every day. In 100 days, that's like 100%.
Improvement.
And that's my goal,
continuous improvement.
Just the little, improve on one thing. So those are some of the things I just use to make sure that I remain a skilled dentist and also protecting myself as a business owner.
Looking back at your journey, if you want to give your younger self an advice, what would that be, and what would you change if you have the power?
If I wanted to give my younger self an advice, I think it'll be not to worry and not to stress. I think in the beginning days, I used to fret so much and stress and worry, but that things always fall in place. The most important thing is to have a mentor, to surround yourself with supportive people at work and at home, and just stay focused. Show up every day, be persistent, and have resilience, and everything will turn out fine. If I was to change anything, maybe I wouldn't be in Windermere.
Why is that?
It's so saturated. It's so with dental clinics.
Yeah.
That's the only thing.
Oh.
I love the location. I love the place. But for most dental clinics, right, they tell you want a place where maybe you're the only dental clinic in like a 2-kilometer radius or something.
Mm-hmm. It's not the case.
Well, like maybe 10 in my 2-kilometer radius. So that's the only thing. But honestly, proximity to home.
Yeah.
Proximity to my husband.
Yeah.
I love the location.
Love it,
so
yeah.
that one is a 50-50. Maybe I wouldn't change it.
In Nigeria, for a pharmacy, for you to open a pharmacy, there's like a law of, the proximity to the nest is not applied in
So
Canada.
I don't think they have law here.
Okay.
Honestly, they don't have any law because the builders are the ones that just take things. They're
Rent out.
just building. Yeah.
Rent out spaces.
And
to
so when
whoever.
those developers, when they start to develop portions of land, they look for 3 things. They look for pharmacy, they look for medical, they look for dental. So you can have a construction here, you have another one beside. They're both looking for the same thing. Pharmacy, because they know that once you're there, those are services that keep going.
People
There's a need.
Yeah.
So they know that those 3 units, if they have it, you keep their mall or the strip mall
busy.
You keep it busy.
Oh, okay.
You keep it busy. So there's no. So instead, the law we have, which is not really a law, it's like a contractual agreement.
Yeah.
Is that when you as a dentist, you're working for someone, we put you can't work within 2 kilometers or 3 kilometers radius, because that means you can go from this clinic to the next.
Oh.
And if patients really like you move patients from one practice
to the other. Oh, that makes sense.
That's how we guard ourselves. But regarding setting up,
yeah. Okay. What strategy do you use in terms of marketing? Considering now that Windermere is saturated, what strategy do you use for marketing, and which type of marketing do you think is beneficial, if I can use that for your business?
That's an interesting question. Yes. For a very long time, I haven't even done much marketing.
Okay.
I haven't done much. A lot of it has been word of mouth. Word of mouth, referrals from people, recommendation. In the last 2 years, we started using Google.
Okay.
Google Ads, right? But still, compared to our word of mouth is almost like 80%. Our Google Ads were like 20% of everything. Interestingly, recently, I think I just met up with a marketing consultant. So I'm actually looking, and that's because of the new dentist that joined us. Because a lot of people that said, come, Dr. Simi, they want to see Dr. Simi. So that's the word of mouth.
Okay.
Now having a new dentist, right? A lot of people, the people that come to me don't know her.
Yeah.
Which is why I feel, okay, now I need some external marketing. So I just met up with a consultant. They're looking to give us a proposal, and they just have different campaigns that they've recommended that we should use. So we'll see how that goes. And I think it's only after we started that I can look back and say what is
this is the best strategy. Okay.
But we haven't done much up until now.
Okay. So what haven't I asked you that you've been thinking a lot about that maybe people may want to know about your clinic?
I think one of the things I can think of is, as an African Black dentist, I feel I'm able to relate to a lot of Black people and their needs, and really explain what challenges or what could be going on with their dental health. Because you find out that people have seen dentists and it's always like in and out. Just tell them you need this, you need that, but they don't really have an understanding. But this procedure they have to do costs so much, and so people don't even know exactly what this is. They just know they need something. So just being able to relate with people and break down that dental knowledge or dental procedure into bite-sized pieces that they can understand is one of the things I'm passionate about. And I always tell people that if it's just to explain to you, you don't have to come to me for that treatment. If it's just to explain to you what someone has proposed,
Yep.
I'm happy to do that.
Oh, that's nice. The last founder that came wanted to know, how do you overcome disappointment in your business?
That's an interesting one.
Or maybe we can do it this way.
Okay.
What questions should I ask the next founder? What would you like to know from another founder? Yeah.
What keeps them motivated in their business? Question about disappointment. I think, honestly, disappointment for me in the business is usually when we have time blocked out for a patient and they don't turn up.
Yeah.
That's because it's like wasted time. Everybody's set up to see that, and sometimes some of our appointments are 90 minutes, 2 hours.
Yeah.
So imagine that downtime of nothing. And how do I overcome that? Of course, that time is a wasted time slot when it happens. But overcoming it is getting an opportunity to actually speak to the person and explain to the person why that time is so important. And we always appreciate, if you just let us know at least a day ahead if you think it's not going to work. Yeah. So I think that's all I can say, because one of the things my husband has told me is, especially regarding dental, a lot of people just don't know. They're not aware. They don't know. But when you explain to people and they see from your perspective, then they can also, if you schedule an appointment, you got the time, you do so. So that's the disappointment I'll say we face, and that's how we overcome it.
Okay, good to know. Is there a founder that you know that you'd love to see on this show to come and talk about their business?
It's good. So you can do Sochi Obuna.
Sochi Obuna. Okay, what are they into?
And she's part of the Nod group.
Oh, Nod. So the handle is the Nod on Instagram. Sochi Obuna. Okay, invite Sochi Obuna to the show.
Okay, Sochi Obuna would like to invite you to join the Founders Podcast. They'll like to know more about the Nod and the great work you're doing out there. Hope to see you.
Sochi Obuna will be reaching out by Instagram. And thank you so much, Dr. Simi, for coming and speaking about your business and giving us more insights when it comes to dentistry. You can reach out to her on
180-540-8155 and www.flourishdental.ca.
Thank you so much, viewers. Keep watching Founders Outlook. Don't forget to like, share, and subscribe.